Hi everyone, I'm Dr. Terri Alani, the Texas Tooth Lady. Don't have my shirt on today, I have my Zoom shirt on. Thank you for subscribing to the channel at Dr. Terri Alani. Really appreciate it. We always have really interesting videos to talk about really cool things in dentistry. And today we're going to talk about something different because I've had requests about how to replace silver fillings and why do you replace silver fillings. So we're going to get right to it. We're going to be replacing some silver fillings on our patient because as they age, what happens is, remember, the only time that you have any type of discomfort on a tooth is if it needs a root canal. So fillings generally will not let you know they need to be replaced unless you get a little cold sensitive and they break down. But what happens with the silver fillings is it's like a puzzle piece. They break away from the rest of the tooth. So it's almost like you could pull out the filling from the tooth. And sometimes a patient gets decay. So we now replace the silver with the beautiful white fillings that we've been doing for the last 20 years. So if you're in your 50s and you have silver fillings, you probably need to get them taken out. So let's go ahead and take a look at the x-ray. And this is what the silver fillings look like on the x-ray. They're white. They're very white. So these are silver fillings, and these are the ones that we're going to be replacing today. Okay? And let's go ahead and take a look in the patient's mouth. We do have a live patient here. Hello.
Hi.
Okay, why are you replacing your fillings?
Because you told me to.
Right, because I told her to. Because this patient is smart enough to have come to see us and realize that we are dental professionals and we know exactly what needs to be done. So we're going to go ahead and we're going to remove the silver filling. The patient's numb. She won't feel anything. I've got my lovely assistant here and we're going to go ahead and get started. Go ahead and open your bib. There we go. So we're going to go ahead and start and going to remove this one right here. We've got the high-speed suction going. And you're fine, right? You don't feel anything? All right, perfect. And basically, we're just going to drill the silver out. And then it's real simple. We'll just place the white material in. Get a little bit more air. Ready, please? Are you okay? And we always ask the patient to make sure that they're okay. Water and air, and keep the suction right up to the tooth on the needle. And you can see we're almost done. This is a very easy procedure. You just want to make sure you get all the silver out of the tooth. Are you okay? Okay. We just have a little bit more to go. I use these glasses because they help me quite a bit, see? And also use a really high intensity light that helps as well. You put that section right up next to the tooth. Are you doing okay? So we're just about done. This is a two-surface filling that we're doing, and we are taking out all of the silver filling. Nobody does silver anymore. It has mercury in it, and nobody likes mercury. Some people think it's toxic. If you have silver filling and they're intact, then you really don't need to have them replaced. You just need to replace them. Just about done. Let's take a look and see what we've got. I'm going to rinse it out. Just a little bit more here. How we doing, patient? So the patient's numb. This is very good. Okay, we now have all of the silver out of the tooth, okay? And now we're going to fill it. Now, filling it is very easy. It's done with a composite material, and it's going to be tooth colored. So what we do first, this is really cool and interesting. We turn our light into a yellow light. I don't need that. Okay, so we have certain steps we do. The first thing we do, it's like painting. So we apply a liquid onto the tooth, and this prepares the enamel. Patient's fine, right? Let's do the next step, please. Then we place the next step. And then we're going to use a light. And this light is going to help set this gel, this liquid. That light stays on for 5 seconds. It hardens the liquid that we place. Then what we do is we've got it's like a syringe, and basically it's a fluid material, and we apply it to the base of the tooth. Can you see okay there, Nancy? And go ahead and zap that. I call it zapping. Where's the gun? And then I'm going to place this in. And we fill it with a certain material that's more fluid-like, and then we use a harder material. And this is all white material. It's very easy to do. Make sure we get the lingual when you set, please. And I like to use my finger. And this really gets it nice and pretty. Okay, go ahead and set that. Twice, please. All right, so that's basically it. Then what we're going to do is we're going to check her bite. Bite down, please. Tap, tap, hard, up and down. And this is to make sure that the tooth is in line with her bottom tooth. And as you can see, she's hitting there first, so we're going to adjust it. So we just adjust the filling, none of this hurts. We polish it to where it looks like a real tooth. And basically, there you have it. Let's take a look at it. Can you see really well? And there you've got it. Let's see if we can see. It's better in the mirror. And that's it. We just now went from silver to white. She's got her a nice new composite filling. I'm Dr. Terri Alani, the Texas Tooth Lady, and that's how it's done.